Welcome to Workforce Wisdom, the podcast where we explore the latest trends and insights in healthcare recruitment. Today, I'm thrilled to be joined by two powerhouses in the industry, Mitzi Kent and Susan Boydell. Mitzi, a partner with Barlow McCarthy, brings over 30 years of experience focusing on creating exceptional recruitment and retention programs. Susan, a principal at Barlow McCarthy, is a seasoned executive with over 2 decades of expertise in physician relations and business growth strategies. Together, they have redefined how healthcare organizations approach recruitment and alignment. Let's dive into their journeys, insights, and strategies for the future of healthcare recruitment. Mitzi, let's start with you. Can you share a little bit about your career journey and how your experience with organizations like HCA, Gentiva, and LifePoint Health shaped your approach to healthcare recruitment?
Yeah, Christy, I think that's a real significant part of my background that has really helped me help organizations because I got a little bit taste of everything, right? So for-profit hospital organizations where it was very driven, growth was front and center constantly. Then when I started to go for nonprofits in rural markets, it was where's that right fit of that candidate for recruitment so that we can grow and keep patients within our community. And then the post-acute side really helped to round out the thoughts of just ongoing relationships with those ancillary providers to make sure that patients kept coming back to the facilities and that as we were recruiting, that there was going to be good relationships for collaboration between all parts of that acute care and post-acute care. So I feel for me, it's really helped me to become a better leader, a better coach, even just a better consultant overall to be able to share with our clients how we can help and serve.
Terrific. And I think that you did a great job kind of going over the differences within those types of organizations, but definitely some similarities to draw on from that experience. So Susan, you've also had a very fascinating career with significant roles at Texas Health Resources and Baycare Health System. How have those experiences helped prepare you for the work you're now doing as a principal at Barlow McCarthy?
Well, it's funny because both were large health systems that came together back when everybody was merging. So you start out with a small working for a hospital, and the next thing you know it, you've got 10 of them. And both health systems were very similar in terms of size, just geography, completely different, one in Florida and one in Texas. But, the biggest thing was I was on the consumer side, and I was always fascinated with the whole primary care world because we never talked to them. We didn't know what they were doing. We knew how patients ended up in our hospital, whether it was through the ED, whether they were coming in for surgery. But what happened out there before they ever showed up at our doorstep was completely unknown. So I'll tell you how it really prepared me was that I called Chris Barlow at Barlow McCarthy and said, I think we need a team to go out and talk to physicians. And that's where it started. And so she helped me twice. And needless to say, I learned a lot. And at the same time, I loved that side of the business, mostly because I could really see the efforts of what we did and learned in the field. Plus, nobody was doing it. It was just us from a health system perspective. I loved all that. And so it led to all sorts of things from there that I stuck with it. I mean, I love the whole idea of growing business and helping organizations understand where their referral and growth opportunity is.
And through a lot of what you said, they really emphasize the creating innovative volume building strategies. Is there a particular example, that was very successful and maybe its impact it had to a particular community or maybe a larger, health system type strategy?
It's so different today than what, I've been doing this a very long time. You can probably tell from looking at me, but I've been doing it a long time and it's different today. So when you say innovative and volume building strategies, what I would look at today would be very different than I could think of several way back 10 years ago that I go, that was a cool thing that we did and what we learned from it. But today it's different. And it's mostly different for all the reasons that probably most people that are listening to this would understand. I know that Mitzi, you do. Christy, I'm sure you do as well. I mean, markets are highly aligned right now. It used to be when we would go out to earn referrals, there was a good pocket of people that were independent, providers that gave a little to this health system, a little to that hospital, a little to this specialist. And your goal was, well, can I get them to give me a little bit more? Well, anymore, they're highly aligned one way or the other. So that world looks different. So when I think of some innovative stuff, it's mostly in this world of, and I know we're going to talk about this throughout our session here, but it's the way we now look at data, the way we now sales plan. We didn't do very much sales planning back in the early days. You did a little, but mostly we were just figuring out how to do really good work, technology, from a technique perspective, field. So that whole piece to me is pretty vital today on how we use data to drive where we're going and sales planning. So those are the two big things.
And I know, Mitzi, you've had a very strong background leading the sales efforts and working through building that volume in the practices and within the hospital. Maybe pivot a little bit to that provider recruitment side. There's a large focus on providing a red carpet experience. Could you explain what that means to you and really how that impacts provider retention, which ultimately leads to that volume growth?
Yeah, Christy, I think that I was fortunate enough to have that sales background to understand from those physicians once they were hired what was important to them. And so I've taken that same philosophy to physician and provider recruitment to really identify the needs of that provider and to make sure that we're matching that well. If I'm talking to a provider and they don't get excited about growth, then and that is one of the top priorities for that organization, they might not be aligned and that physician might not stay for very long. But if you can find out from what's important to that physician first, what I always say is have them tell their story before we tell ours, and really then match the benefits of what we can do as an organization. We seem to better align. And I do think that having physician relations teams involved in that recruitment process just shows that extra commitment to that physician. So that red carpet really looks like what's important to you, and we're going to tailor what our organization matches your needs versus just this is the job, here's what the hours are, here's the call schedule, right? It's putting that all together.
Mitzi, you bring up such a good point. You know, when I'm talking about this alignment and how aligned markets are, the other thing we hear almost everywhere, and Mitzi, you're going to be all over this, okay, is everybody has some sort of access problem. And that access problem is because they don't have enough physicians in certain specialties. So the synergy between recruitment and the field team is like vital, because I'm going to tell you, the field team is just like, so when's the new neurologist going to be on board? Because they're ready to get them busy, even though I tell you they'll get busy on their own. But that synergy and how the two work together, I think, is a big piece. So I love everything you said, Mitzi. It fits right in line with the world out there.
Yeah, I think many organizations are missing that key link of really learning that market intelligence. Nobody knows that market intelligence better than the physician relations teams.
And I think, Mitzi, you're a longtime road warrior and you presented at many national professional association conferences like MGMA and the APPR conference. Are there other trends or innovations that you're seeing in healthcare recruitment, maybe in the past couple of years, that have resonated with your audience more? Or as you're speaking about that inclusion of the liaison folks within, is that being met with resistance, or people accepting and understanding why they should include those folks?
What I'm seeing the most is, how do I know I'm getting the right physician, provider, nurse practitioner, whatever you're recruiting for my organization? So I always talk about there's 3 C's to that, right? It's the clinical fit, of course, but it's also the cultural and community fit. And many of times us as recruiters, we have the ability to really hone down and really see if that physician or that provider is aligned with our mission and values. And then to understand that with how do we ask those questions? How do we assess for that? So lately, most of my talks have been around that behavioral questioning, that behavioral information, to learn more and to see how this provider would be a fit right? I don't feel that there's much resistance when it comes to how do we involve physician relations. It's almost as an aha moment that they'd never really thought about that piece, is that the physician relations team can be a huge selling point to that provider, especially at that on-site visit. If they know that there is a team or a person that is dedicated to looking at their volume and helping them get connected, I mean, what physician wouldn't want that? So I find it to be a huge selling point. And so when we try to talk about how to make those connections, I see a light bulb go on.
Yeah, and I think as recruiters, you're often asked from the surgeon, they're asking a ortho surgeon, gen surgeon, they're asking about blocked OR time or even procedural space, right? Of endoscopy suite stuff. And you're absolutely right. The people who know those things and who can speak to them in terms of that. I think the other thing, kind of a loaded question, but does that support from the liaison, you said have them be involved in that site visit to make that kind of business introduction? Does it end there? Or do you take that further where then they're the person taking that clinician out on the road to meet the community and probably their other referral source physicians?
No, it doesn't just stop there. I feel that the physician liaison teams and relations teams need to be involved in that strategy planning, right? So for most employed physicians, as recruitment comes in and the onboarding starts, there's a process there where I think physician relations can be involved. They can come in and talk about how they get introduced into the community. They can even get that time and set up so that that provider is aware that they have to make this time commitment and they're going to be accessible to the physician relations team. So I think it's the ongoing, right from the time that it's signed. They should be on that email where, guess what, we just signed this doctor and here's the start date. Wouldn't the relations teams love to know that ahead of time versus, oh my God, he's not busy. Can you hurry up and get him out there and get busy, which I know Susan hears all the time from teams. So I think it'd be important.
Here's the piece I would add to that because it just fits in with what the market looks like today. Field teams, liaisons need to understand when a new specialist comes in, what makes them different. Why would somebody refer to them when they're happy with who they're referring to right now? So why this new specialist? Because it used to be we could just put them in the car and take them around, but anymore, not so much. Because everybody's pretty aligned and everybody has that, those liaisons are hungry for that piece. And the best way to do that, Mitzi 100% gets this, okay, is that I don't want to wait till they get here. So when you were talking about involving them earlier, I want to know that beforehand because I'm going to start to have conversations in the field with referral sources about what's something new that's coming to the health system. Because then I can even come back into my organization and say, this is what the referral base looks like. This is where we're going to be starting. Because so often we sometimes think that, oh, we can get them super, super busy if we throw them in the car. And sometimes it's not that easy. And it's the field team that's going to help to quantify what that opportunity is and how much time it's going to take to get them there. So, Mitzi, all good points.
Yeah, and Susan, I know you speak nationally as well at several different associations and conferences. To further illustrate the point on some of the strategy that you've talked about, I'm curious where the physician liaison, and Mitzi knows I 1000% that the recruiters are in the room as you're doing some of that strategic planning and your workforce or your medical staff development planning. Is there a spot for the physician liaison or equally, the feedback that they're hearing, you keep saying field work, how should that be incorporated to really educate the team that's putting a stamp on, okay, this is our plan for the next 3, 5, 10 years in terms of recruitment?
Well, I think the biggest piece that the field team can bring to those internal teams as they look at that, because like you mentioned, it starts at medical staff planning. What do we need? How many do we need them? Where are we going to put them? All of that. The piece that needs to be right in line with that is how big is the referral funnel? How many referrals are there to feed these specialists? How long is it going to take to get them there? All of that's important. And Mitzi, you probably see this all the time. There's a lot of specialists that have very unique and specific things they want to do. And sometimes we on the growth side will say, well, boy, oh boy, there's not enough people presenting in a primary care office or in a specialist office that would need the subspecialty work that this physician is doing, they can help with what's available in the local market. And then where are you going to have to go to get that? So it's all intelligence that data can feed a ton of that. But the intelligence about what's happening specifically in an office and how easy it's going to be able to move some long-standing referral patterns, they're different. One of the greatest things right now is when there's access issues in a market, and if you bring a specialist in that's going to open up that access and they're at a quality level and doing things that others aren't going to do, they're going to get busy. So that intelligence that the field team brings from the field that just sits on top of everything that medical staff planning might do, but also what your data can tell you, all of it.
And Mitzi, give me your 2-minute elevator speech about how important doing something like secret shopper calls could be to further enhance that intelligence.
I'm really surprised about how many organizations don't take advantage of wanting to really see what's going on, right? So when we do a medical staff development plan, we'll want to always talk to the physician relations folks because they know that market intelligence. And then on top of that, want to verify with some secret shopping calls, calls into those offices about what it really is like for that access. And if we're telling a physician as we're starting to recruit them into the organization, what's our plans? Look, they're not looking for everything to be perfect. They just want to know you have a plan to fix it. And so that better prepares that recruiter for when they're having those conversations or they're making choices between your organization or another organization, is because you've got that market intelligence from your physician relations team, but you also have the market intelligence from that secret shopping to say, look, here's where we've identified the problem, but here's what we're doing A, B, and C to fix it.
Susan, I know that you're known for being a visionary thinker and exceptional relationship builder. Can you give us maybe some quick tips of how you foster trust and consensus, especially on these high-stakes projects where there's revenue attached to everything we've talked about for these health systems or the clinics?
It's a great question, Christy. And I'm going to give you one word. It's listening. I think understanding and listening to Mitzi said so much about this too, about what they hear when from a recruitment perspective, about what they need, what's important to them, and how that has to match up with a physician. It's very much the same way. There are things that happen in the market, like my alignment thing that we just shared, all of that. But every single market and every single health system and every single physician is unique. And so it's understanding the very specific needs that somebody has within their organization and thinking about the unique way in which we fill that. So the listening piece is huge because you will learn so much. And it's in everything that we do. We tell a liaison, one of the most important part of your job is good listening, because what we want to learn, we learn because we listen and ask the right questions. So I just sit by that all the time, that I got to ask the right questions, but listening is a huge piece. And then this goes without saying, we're able to deliver. But the front end of what we're delivering is all based on understanding what's most important to them and then putting together what that unique solution is going to be and then delivering on it.
Mitzi, I know you have a nursing background, and I think you maintain your nursing license, which is awesome. With that and your leadership style, are there lessons over your career where you've learned in particular to navigating recruitment challenges, and maybe does it tie into some of your nurse training and maybe triaging or addressing some of those issues?
I always say that I do have an advantage that I have a nursing license. I do keep it active in Tennessee. You never know. And I do just some volunteer work where my nursing license needs to be active. But I think what we find mostly is that when we have a sourcing team on a team and they're out and saying, hey, you need to go find a HEMONC doctor, or you need to go find a urologist or a GI doctor. Do they fully understand that clinical service line, right? And if they've got to be very well versed on the procedures. So I think my clinical background helps in the fact that when we do a lot of training with organizations and new sourcers are coming on board, or even new recruiters are coming on board, We always just say, can we have a clinical immersion call? And what we mean by that is really making sure if this is a service line that you're going to be recruiting for and you're going to be talking to providers, you really need to understand everything that's on their CV and what's important to them. So if they say, I love to do this procedure, but you don't really know what the procedure is, or if your organization even does that. So we need our teams to be very versed on that. And I think what my clinical background does for me, and I think for Barlow McCarthy, is that that's just part of how we train from a clinical perspective. You don't have to be a nurse, but you do need to understand how that service line impacts the organization, how it contributes, and then clinically, what's important to those type of providers that want to be recruited into that marketplace.
Yeah, and I would tell our listeners, it's that background and those things that you've shared. Definitely those are teachable moments. Spending time, go shadow in the ortho practice or the cardiology practice so you can get a feel for it. We use so many acronyms in medicine, but the only way to really get in there is to go in the hospital or go in the clinic and spend that time.
Yes, absolutely. I think that should be part of everybody's as a source or a recruiter for a certain service line to spend time with your service line leader, not only just to understand the service line, but to build the relationships, right? There's that external customer of the provider, but there's that internal customer of your service line leaders and that you're recruiting for, the practices you're recruiting for to make sure you find them the right candidate.
We can definitely Google or AI a lot of different questions about what things are. What is ECMO? What is a cabbage? But until you go and really see that, I think the other side would also be if you haven't experienced that from a patient's viewpoint, to go through and see that. And really, that's where you see all of the recruitment stresses that you're going through, but you see that greatest impact when you have that patient or that patient family in the community really recognized, oh, you're the one, like you found that doctor or that physician assistant or nurse practitioner, and they helped save this person in my family.
Absolutely. I think it's so vitally important, especially if they're not from the healthcare market coming into healthcare recruiting. You have to immerse yourself in that.
Hope you're enjoying today's podcast. Just wanted to break in here to remind you of PracticeLink's new Physician Resource Center at PracticeLink.com. To check out our Physician Resource Center, head over to PracticeLink.com today. PracticeLink's Physician Resource Center is a collected hub of content which includes valuable resources and information about contracts and compensation, the job search and interview process, quality of life and wellness, and many, many more areas designed specifically to inform and support physicians' professional growth and success.
So we've talked a little bit about technology and kind of leveraging where you can, but then actually boots on the ground, working and asking people and listening to what's happening in the field. Are there any emerging technologies that you see kind of transforming the space that you're in? And then are there certain things that are more recruitment focused or retention focused in terms of keeping providers happy, let's say, in their practice so that they can continue to grow?
Well, here's where my head first goes from a hospital and a health system perspective. In the referral growth space, and where technology or looking at things differently might go, is everybody in a hospital or health system, especially in physician relations, are still trying to figure out how they track the actual referral. We know once they've hit our system, we can see in claims data what the relationships are. We have so much more data now than we ever had. It's amazing. But we still struggle with being able to connect the dots to the activity, to the actual first step of that referral, sometimes the second or third step too. And so I see in the future that, some folks are doing things through their EHR that helps with that. But I'm thinking technology is a piece that's going to come in to help with that, managing that whole journey of the patient. And when I think of how we manage that whole piece and the data that we get from that, and the value it can provide back to like the referring physician and their experience in working with us, think about just communication. So they send someone a patient, they still struggle with getting the communication they need from a primary care perspective about what's happening with their patient. What's in some places, because access is so difficult, did they ever even get scheduled? You think about all of that and how technology can begin to bridge the gap from where we are today to where we'll need to be. We're better but we got a long way to go. So when I think of big picture stuff coming down the pike, I think about that piece because it helps us better understand what's happening referral wise. It helps us better improve the whole referring physician experience, which then you take that one step further and you go, there should be improvement all the way down the road, right to the patient. So that's my thinking.
I agree with Susan there. And then to use that information of that patient journey to share with the provider as you're recruiting them, right? There have been many of times where teams are saying, I was at that on-site and they're asking questions and just being in the institution and the organization going, okay, so then how do the patients arrive here? What is that experience for that patient? And for that recruiter to be well versed on that, again, partnering with their relations folks to be able to do that. But I think it's really important from a technology perspective is there's so many great platforms to find your candidates, but how are you using that data to really not just maybe do a blanket email blast, but personalize some of those messages to that physician? And again, really finding out what they're looking for and seeing where that they can be a fit. So I think today it's all about when I'm talking with a provider, I want to understand what's important to them, but also that they understand us as an organization and how we are committed to making sure that patient also has a red carpet experience and talking through that journey with them. But I also think it's important for us as we're trying to identify candidates, finding that platform for you to be able to consistently follow up and be mindful of your talks with that candidate.
We all know if these things aren't done from either the initial strategy sessions and then the recruitment and onboarding and then the retention, you get to that point where you've got some leakage and you've got that out migration of your patients and that market. So Susan, some of your extensive work has been on reducing the leakage. Are there specific strategies you've found that are the most effective in addressing that? And then how does that connect you to like the broader vision for physician relations?
I would tell you that in most organizations, I think we've gotten way better at understanding leakage out of employed practices. They can see it, they can understand it, they can do something about it. I think that piece has gotten a lot better. I think where we're missing the mark is looking beyond just that piece. And sometimes it's just starting at your access points, all your access points, and saying, what happens to the patient throughout that access piece? One of the things that we're doing some work in is in the ED. So think about a patient that comes into the ED, but doesn't get admitted, but needs to follow up. Let's just take orthopedics, needs to follow up with an orthopod. Let's say they broke a bone, they did something, they ripped something on the orthopedic side. They need to go see an orthopod after they leave the ED. We tell them that, and then we send them on their way. About what processes could be put in place to grab that patient. And right there, let's just manage how that patient moves through that journey. So I think it's looking at all the access points and it's understanding, well, where do we have gaps in our referral process? Because I think when we say referrals, we think so much about the field team. They go out, they talk to the primary care. So when the primary care needs to send somebody, they think of us and they send us to us. That piece always has opportunity to work better because we just got to get smarter at it. But the bigger picture is, where are all the other places where that journey is got a gap or something's not working right and we lose them? And I think that can be an area where we can get a lot smarter.
And I'm sure, Mitzi, you've done a lot of work in the rule setting for their programs. I think that leakage or those types of pieces could have even a more disastrous effect if you've invested in bringing a specialist to a rural community and you're not making sure that all of those pieces that Susan mentioned are taken care of along the way. There's certain things that people should do differently as they kind of address the differences or that disparity when you're in like a rural setting.
It's amazing to me that folks are just thinking, well, I can't recruit that particular provider because, we just don't have enough patients or we don't know what our community needs. So I always advise some of these rural markets that a medical staff development plan is really going to level set to them about where they are today in the community as far as that need, but where they see themselves 3, 5 years, and even 10 moving forward. I will say that we worked with a client out in the Nebraska area. Shout out to Amy, who is a phenomenal biz dev person out there that has done an amazing job to bringing the providers to the community in an out of the box kind of thought, more of a multi-specialty clinic that they might just have the specialty there for a couple of hours, 3 days a week. So I think it's important as us as recruiters is to really understand where that volume is, and then to be bold enough to say, you know what, we think that we could probably maybe job share this if we brought these different types of providers in, but really strategize with the service line leaders to say, we need to have this service line in this market so that we don't see that leakage going to the bigger communities. And here's where I've seen other organizations or that I've learned over at, AAPPR or different places that we could probably address this. So maybe we look at this differently than just the physician in the outpatient clinic from 8 to 5.
Sure. And I do think the more residents and fellows that the PracticeLink team talks to, they're looking definitely for that work-life balance. But that schedule flexibility is very key. I think as you look at a certain age demographic of physicians, and definitely COVID showed us this, that they're more than willing to be paid less if they have some of that balance back. And so don't overlook the person looking for a 0.6 or maybe a 0.8 FTE, or partnering with potentially a larger organization or somewhere near, right, with your community. So to get that coverage, you do have an endocrinologist coming twice a month or cardiology coming more frequently so that those community members have access to that care right at home.
Absolutely.
So finally, for our listeners who are either just starting out or looking to refine their strategies, what advice would each of you give to them for navigating the evolving field of healthcare recruitment and business development?
We're in a great place. Mitzi, I think you probably would say the same thing, because I think things are changing and moving, and it's the right time to do that. We've been talking about it for quite some time. My bigger picture for people is if you've been doing this a long time, like have the traditional referral development approach, now's the time to rethink it. And rethinking it can be anything from how am I working with my recruiters on what they're bringing in and helping to inform that piece. It can be on understanding the market better. One of the things we just believe in is I got to understand what are the referrals I can earn. That's very different than let's just go out and get them. Like if I send my field team out, I'll grow business. And anymore, it's not that simple. So I would say that bigger piece of understanding referrals. And if you need help with data, data's a big piece of it, because we got to understand, where do we spend our time? Where do we get the biggest bang for our buck?
I'm going to echo that. I think personally, it is so important now. If you've been doing this a long time, recruiting, and there's a lot of recruiters that have been, that you do a couple of things that you think, what can I do differently to get better results? There's an old exercise of start, stop, and continue. I would encourage you to see, what do I need to start doing? What do I need to stop doing? And what do I need to continue to keep doing? And for the leaders out there, there's a couple of things I would say. Invest in yourself. It's important for leaders to get that education, whether it is to find yourself a leadership coach, a collaborative to be a part of. This podcast is excellent. If you're listening to this podcast, you're on your way for helping to develop yourself. But maybe it's a time as a leader that you say, I want to step back and look at my team and see how we can structure differently so that we can really make a difference and have these providers stay. So do I need education for my team? Do I need to identify who on my team has what strengths and restructure the way that we are? I think this is the time to be looking at that and to do things differently. But I'll always encourage everyone, if this is your passion, to invest in yourself to learn more.
I completely agree. I think that personal growth should always be right there on your list. On behalf of PracticeLink, I want to thank you both, Mitzi and Susan, for joining me today and sharing such incredible insights and experiences with our listeners. For our listeners, if you'd like to learn more about the work that Mitzi and Susan are doing at Barlow McCarthy, feel free to check out their information on the PracticeLink Resource Center, www.practicelink.com. They can help both physicians, those running practices, and recruiters, obviously those physician liaisons that they are both passionate about, really help set you up for success with some strategies. And as we've said, kind of look at what the structure looks like and how they can help with your programming there. Please feel free to reach out with any additional thoughts or insights about what we covered today. You can email us at plmedia@practicelink.com or visit our website. My name is Christy Bray. I thank you again for listening to Workforce Wisdom.